Proposition 23 establishes state requirements for kidney dialysis clinics, requires on-site medical professional, initiative statute. Plain language, increase rules and regulations on dialysis clinics. Hello, if you're just now joining us, this video is part of a complete series. Please visit the link in the description to watch the full playlist and find out about some of the free aids available to viewers of The Darryl Johnson Show. The background. We have kidneys. They filter our blood to remove waste and extra fluid. Sometimes they stop working, and when that happens, you need dialysis to artificially perform this function. Most people in California with kidney failure receive dialysis at chronic dialysis clinics, though some get it in their own homes or at a hospital. There are about 600 licensed chronic dialysis clinics in California that treat roughly 80,000 patients each month. Because it takes 4 hours for a treatment, and most receive treatments 3 times a week, clinics often offer services 6 days per week and are open outside of typical business operating hours. When a patient has kidney failure, their doctor is the one who creates the plan of care and outlines how the patient should receive dialysis. Under federal law, the doctor must visit the patient during dialysis treatment at the chronic dialysis clinic at least once a month. 2 for-profit companies, DaVita and Fresenius Medical Care, operate nearly 75% of all California dialysis clinics. The other 25% are owned by a combination of nonprofit and for-profit companies. Most chronic dialysis clinics earn a profit, but some operate at a loss. Some companies own multiple sites where some are profitable and offset the other sites that are not profitable. Chronic dialysis clinics have a total revenue of more than $3 billion annually in California. Their money comes from 3 main sources: Medicare, which pays for the majority of people on dialysis in California; Medi-Cal, which covers low-income Californians; and group and individual health insurance, which is like employer or union-based healthcare or private insurance. Most California state employee insurance is group health insurance coverage. Medi-Cal and Medicare have used the arm of the law to basically pay near the actual cost of providing the treatment. Meanwhile, group and individual health insurers pay multiple times what the government programs pay. Chronic dialysis clinics in California are licensed and follow federal regulations. Federal regulations require a medical director at each clinic. Federal regulations require each CDC have a medical director who is a board-certified physician. The medical director is responsible for quality assurance, staff education and training, and development and implementation of clinic policies and procedures. Federal regulations do not require the medical director to spend a specific amount of time at the CDC. However, federal guidelines indicate that the medical director's responsibilities reflect about 1/4 of a full-time position. To receive payments from Medicare, CDCs must report specific dialysis-related infection information to the National Healthcare Safety Network at the Federal Centers for Disease Control. For example, CDCs must report when a patient develops a bloodstream infection and the suspected cause of the infection. And we interrupt our kidney talk for our Prop 23 trivia question. The kidneys filter your blood throughout the day. How many gallons of blood do your kidneys filter every day? The answer coming up soon. What does it do? Prop 23 would require every clinic to have a doctor on site during all treatment hours at the expense of the clinic. If there is a shortage of doctors in the area, a clinic can apply for a 1-year exception that will allow them to use a nurse practitioner or physician's assistant instead. Their responsibilities would be to ensure patient safety and quality medical care. Under the guidance of the California Department of Public Health, clinics must report required information about dialysis-related infections every 3 months. This information will be posted on the CDPH website. If a clinic doesn't report, they could face a fine of up to $100,000 depending on severity. This money would be used to enforce dialysis clinic laws. Prop 23 would require a clinic to get permission in writing from the California Department of Public Health if they plan to close a clinic or significantly reduce services. The CDPH would base its decision on such information as the clinic's financial resources and the clinic's plan for ensuring patients have uninterrupted dialysis care. A clinic may dispute the CDPH's decision by requesting a hearing. Finally, Prop 23 would prohibit a clinic from refusing care or offering reduced care to a patient based on who is paying for the patient's treatment, whether it is the individual themselves, private insurance, Medicaid, Medi-Cal, or Medicare. Fiscal impact. The fiscal impact of Prop 23 would be complicated. Firstly, this proposition would increase the cost for dialysis clinics, adding several hundred thousands of dollars annually to their costs. This would ripple out into the state economy in a few possible ways. Clinics may raise prices on both private and public payers. This would increase state costs. Clinics may simply operate with less profits, which wouldn't add to state costs. And some companies may close clinics to cope with increased costs. This would ultimately increase state costs. In either case, this is likely to cost the state somewhere in the low tens of millions of dollars as payers cope with higher dialysis charges and as some clinics close, leaving patients to get treatment at more expensive locations such as a hospital. The legislative analyst notes that a less likely but possible option would be that many clinics close, leading to significant and uncertain costs to the state. There would also be added costs to the California Department of Public Health, but this would be offset by adjusting the cost of the annual licensing fees to the clinics. Have you struggled to pee lately? Do you want to leave your family and friends a legacy of pee? The Darryl Johnson Show Clinic is here to help. We don't just help you pee, we help you pee. PayPal Patreon, that is. Supporting the Darryl Johnson Show is like making an investment in gold. The price will go up, up, up. Feel the relief of releasing PP at either of these sites and watch your gold grow into new and stronger episodes of the Darryl Johnson Show in future years. We want to help, but we can't do it without PP. PayPal Patreon links are in the description. You can help. We're waiting for you. From Yes on Prop 23. Life-saving changes for dialysis patients. 3 times each and every week, 80,000 Californians with end-stage renal disease go to one of more than 600 commercial dialysis centers in the state where they can spend 3 or 4 hours connected to a machine that removes their blood, cleans it, and returns it to their bodies. Dialysis literally is what keeps them alive, and they must continue the treatment for the rest of their lives or until they receive a kidney transplant. Because the lives of these fellow Californians are so dependent on dialysis that is done both safely and effectively, we give our absolute support to the Protect the Lives of Dialysis Patients Act, an initiative appearing on the November 3rd ballot. This initiative will make common sense improvements to dialysis clinics that will protect some of the most medically vulnerable people in our society, no matter if they are located in a wealthy neighborhood or a poor, rural, black, or brown neighborhood. In 2018, the California dialysis industry spent a record $110 million to defeat an initiative to improve conditions in dialysis clinics and protect patients from inflated billing. Why did they spend so much? To protect their massive $468 million in profits in California in 2018. The initiative does 4 major things. First, it requires a doctor or nurse practitioner to be in the clinic anytime patients are being treated, which is not currently required. Dialysis is a dangerous procedure, and if something goes wrong, a doctor or highly trained nurse should be nearby. Second, dialysis patients are prone to infections from their treatments that can lead to more serious illnesses or even death. This initiative requires clinics to report accurate data on infections to the state and federal governments so problems can be identified and solved to protect patients. Third, like all other life-saving healthcare facilities, this initiative says that dialysis clinics cannot close clinics or reduce their services unless approved by the state. This is also designed to protect patients, particularly in rural areas, to make sure they have access to dialysis treatment and to stop the dialysis corporations from using closures to pad their bottom line. Fourth, it prohibits clinics from discriminating against patients because of the type of insurance they have, and it protects patients in every clinic. Don't listen when the dialysis industry claims that this initiative will create huge new costs, or if they say that patients will be harmed, or claim that it will create a new shortage of doctors. Those fake arguments are just designed to use patients in the coronavirus pandemic as scare tactics in their dishonest public relations campaign. The fact is, these corporations can easily make the changes and still make hundreds of millions of dollars each year without disrupting our healthcare system. Prop 23 will make the changes we need to truly protect dialysis patients. We urge you to vote yes. To patients, dialysis is life-saving. But to industry executives, it's a huge moneymaker, so they're at it again, stoking fear by threatening to close clinics if Prop 23 passes and they're held accountable to higher standards. Once again, they are using gravely ill dialysis patients to shield their perks and million-dollar salaries. They claim falsely that the initiative will cost them huge sums of money, based on a highly dubious study that they paid for. They claim doctors are against it, but many of those doctors are on their payroll. They say it will cause doctor shortages and overcrowded emergency rooms, but kidney doctors do not staff ERs. They say dialysis clinics are already highly regulated, but they face far fewer inspections than other health facilities, and even so, deficiencies are often uncovered. Prop 23 makes common sense improvements to protect patients' lives. Once and for all, Californians can protect fragile dialysis patients by voting yes on Prop 23. Here's the answer to our trivia question for this episode. The kidneys filter your blood throughout the day. How many gallons of blood do your kidneys filter each day? The answer, 45 gallons per day. They filter half a cup of blood every minute, which works out to about 45 gallons per day, or enough to fill a small bathtub. If you're participating in an election prep night, the person who guesses the closest number wins 3 points. Anyone who guessed a number between 35 and 55 gallons gets 1 point. From No on Prop 23. Nurses, doctors, and patients urge no on 23, the dangerous and costly dialysis proposition. Prop 23 would force community dialysis clinics to cut services and close, seriously jeopardizing access to care for nearly 80,000 Californians with failed kidneys who receive dialysis treatment 3 times a week to stay alive. Dialysis treatment does the job of the kidneys by removing toxins from the body. Missing a single treatment increases patient risk of death by 30%. Proposition 23 would force dialysis clinics to have a physician administrator on site at all times, even though they would not care for patients. Each dialysis patient is already under the care of their personal kidney physician, and dialysis treatments are administered by specially trained and experienced dialysis nurses and technicians. This useless bureaucratic mandate would increase clinic costs by hundreds of millions of dollars annually, putting half of all clinics at risk of closure, sending tens of thousands of vulnerable patients to emergency rooms, creating longer ER waits, and reducing capacity to deal with serious emergencies. Dr. Jeffrey A. Perlmutter, MD, president of the Renal Physicians Association representing 3,500 kidney doctors, says, "Every dialysis patient is under the care of a physician kidney specialist, and dialysis treatments are administered by specially trained nurses and technicians. It makes no sense to require physician administrators on site full-time." Proposition 23 would make our physician shortage worse and lead to more emergency room overcrowding. Dr. Peter N. Breton, MD, and president of the California Medical Association, says, Proposition 23 would take thousands of doctors away from hospitals and clinics where they're needed and place them into bureaucratic jobs at dialysis clinics where they aren't. This is not the time to make our physician shortage worse. Prop 23 would increase healthcare costs by hundreds of millions of dollars. According to a study by the Berkeley Research Group, Prop 23 would increase healthcare costs by $320 million annually. This is a massive increase that would be especially damaging when so many Californians struggle financially. Dialysis clinics are strictly regulated and provide high-quality care. The federal and state governments extensively regulate dialysis clinics. According to the Federal Centers for Medicare and Medicaid Services, California dialysis clinics outperform other states in clinical quality and patient satisfaction. This is another special interest abuse of our initiative system. The same group promoting Prop 23 spent $20 million last election pushing a similar measure voters rejected. They're at it again, pushing another dangerous dialysis proposition. The NAACP of California says, kidney disease disproportionately affects people of color. Prop 23 hurts minority patients and those in disadvantaged communities the most. Doctors, nurses, and patient advocates say no on 23. And here we are for another attack of deja vu. This time we won't hop in the time machine since this one is different enough from the 2018 version. This is an obvious yes, and by yes I mean no. I don't see any reason that the state should be able to decide when you can close your own business. That's very Kim Jong. Then they have all these other regulations that will increase costs and essentially force private companies to absorb the burden that the state itself cannot handle. There's no surprise that California would be all over a law like this, but as far as I'm concerned, it's a gross overreach. Do you want Gavin Newsom all up in your kidneys? Imagine you own a business. Should the government be able to tell you what customers you must take, how they can pay you, and when you can close your business? They know they are making the state so insane that they have to force people to keep business here. California is on the cutting edge of trying to manufacture a bloated, unsustainable healthcare system. The reason they have to have all these laws is because they can't manage their impossible promises, so they have to force companies to take their absurdly unprofitable healthcare insurance and then forbid them from closing after they collapse under the weight of all of these mandates. Pass. If you vote yes on Prop 23, you are voting to add these new regulations to the dialysis industry in California. If you vote no on Prop 23, things will remain the same. The Darryl Johnson Show says no on Proposition 23.